Welcome back, Titans, to another SBC EMS lecture series for EMT and paramedic programs. Today we're going to be talking about the 9 rights of medication administration. These examples and the 9 rights are coming straight out of the Nancy Caroline, Volume 1, Edition 9, and we're going to kick it right off. So, may seem simple, but the first right that before we're delivering a medication to a patient, is it the correct patient? Now, if you end up in a nursing career, you're a physician, PA, or even a triage situation, you may have more than one patient, or even in the field on scene before additional resources come to you for assistance. You make sure that double check and triple check that you're giving the right medication to the right patient. If you forget, you can double check their name, their birth date, the medication, all those different things. Make sure you're giving the right medication to the right patient at the time. Number 2 is the medication and indication. Obviously, with manufacturing changes, and I'm going to show you a quick example of 2 medications that look very similar but are very different, labels can change. So we're always double or triple checking the medication that we're about to administer. And we're also double checking and cross checking with other clinicians and ourselves if the indication is correct. If I have A, then I need to give B. Everybody agree, we double check that. So that's right number 2. Number 3 is going to be your dose. I'm going to make sure that when I'm about to perform a medication administration, I'm doing the right dose. You can double check it, check on your protocol book. You may have to do an online med consult, gather assistance from other clinicians on scene. We make sure we have the right dose. Number 4 is the right route. Now, as you go through EMT and paramedic school, we understand that different routes of medication administration are vastly different. Most of the time it's because either we need access for speed or we want to slow the patient medication down. An example would be the majority of the time we have IV access on our patients, so we want to deliver a medication right away so it starts affecting that patient to reverse cause or anything right away. Whereas we also have like an IM injection where that's going to be slow absorption through the muscles and slow absorption into the body. So when you're doing your 9 rights, we have our patient, right medication indication, we have our right dose, and we have the right route. This is going to mostly fall into your protocol, intranasally, PO, IV, IM, all those different things. We're going to make sure we have the right route. Number 5 is the right time. Kind of similar to the route for as far as speed goes, we also want the time because there's a frequency to maintain a therapeutic level. Like if we're giving nitroglycerin, is this the right time to give it? Because we know we give it every 3 to 5 minutes for anginal equivalents, or we're trying to vasodilate, so we're going to make sure we're giving the right medication at the right time for that patient. Going on to number 6 is our patient education. So patient education, obviously anytime we have a patient, we're going to deliver a medication to that patient. We're going to inform our patients via education what it is. We'll stick on nitro for a second. We're saying to our patient, I'm going to be giving you some nitroglycerin underneath your tongue. It's a sublingual spray. We want to educate them on what we're doing and what the potential side effects are. Like say nitroglycerin, you could have a little bit of drop in your blood pressure, you could have a little bit of a headache, it may taste weird, all those different things. Keep your patient informed of what you're doing for them. Number 7 is the right to refuse. Patients with appropriate decisional capacity, A&O, GCS 15, they're cognizant of their surroundings and everything else, and they have the right to refuse anything. This could be an IV, it could be pain management, it could be a living will where they don't want a certain thing done. Patients have the right to refuse treatment. Obviously, if it's high risk, I would encourage you to seek online med consults with a physician or document it appropriately in your narrative. So we have our right patient, right medication indication, we have our right dose, right route, right time, right patient education. We know the patient has a right to refuse. And now we're looking for the right response and eval. Now that we've decided to give our medication, we are looking for the appropriate response in the monitoring of that patient. If you're giving a patient an opiate for pain management, I would expect to see that the response of my patient is going to diminish their pain a little bit. And I'm also going to continue to evaluate and monitor that patient to make sure we're trending on the right scale and that we're going in the right direction. If something's off, I may have to change something. And finally, right number 9 is documentation reporting. This could be your patient care report, your EPCR, however your agency or your jurisdiction does it. But the last thing is appropriate documentation. Anytime we do a medication administration, we know that we're going to put the correct dose on there, how we gave the medication, we did a repeat set of vital signs, and what was the indication and everything for. So those are your 9 rights. Hope that helped, and always cross-check.